Welcome to the Sync podcast series, Stories in Health Innovation Through Interprofessional Collaborative Practice. My name is Dr. Tom Ryan. I am the former Executive Vice President and Chief Medical Officer for Mary Washington Healthcare and serve as the Sync Program Director. As we are aware, modern medicine has been evolving to rely more on interdisciplinary clinical teams and wider systems of care than on decisive individualism from any single professional group. Recognizing this trend and the gap in relevant training, we developed the Sync program, an innovative statewide partnership. The partnership includes the Medical Society of Virginia, the Virginia Hospital and Healthcare Association, the Virginia Nurses Foundation, the Virginia Pharmacists Association, and the Virginia Department of Health, and Community Health Solutions. This program brings together all members of an interdisciplinary healthcare team. Teams attend 6 half-day training sessions on topics of leadership, creative problem solving, 21st century healthcare, operationalizing interprofessional collaborative practice, and individual and organizational wellness. They are asked to come to the collaborative with a project idea unique to their organization and put their learning into practice by developing that idea. Project support is provided throughout the program from our knowledgeable staff. To date, 50 teams have participated in Sync and have tackled a wide variety of topics, ranging from the specific initiatives around chronic disease states, improving emergency room patient flow, to integrating oral health education into our patient offerings. There has been involvement of a great mix of teams from across the Commonwealth of Virginia and across healthcare practice settings, with a wide variety of disciplines represented. We will highlight some of the wonderful work that has taken place and lessons learned by interprofessional groups that have gone through the program. Our hope is that in sharing these stories, you will gain ideas, learn from the experience of others, and further foster the spread of healthcare innovation. Now, here is your host for the podcast, Steve Horan of Community Health Solutions.
Welcome to the Sync podcast. I'm Steve Horan with Community Health Solutions and part of the Sync support team. Today, we'll be talking with Stacie Stevens, Stroke Program Manager with VCU Health. Stacie will share her experience with an innovative project conducted by a team of Sync graduates from VCU Health, Chesterfield County Fire and EMS, and the Virginia Department of Health. Welcome, Stacie.
Thank you, Steve. Happy to be here.
It's great to have you. This is one of our favorite projects in Sync, and we're excited to talk to you about it. So today we'll be learning about your Sync capstone project, in which the partners work together to improve secondary stroke prevention among a high-risk community population. We're excited to learn more about how you made this project happen. And to begin, why did you think it was important to focus your project on secondary stroke prevention? And what were you aiming to accomplish at the outset?
Stroke is incredibly preventable, and working with stroke patients for 14 years, one of their biggest fears is having another stroke. And this is something that we can influence. The guidelines really focus on medical management, and our team wanted to take an innovative approach to positively influence the modifiable risk factors, such as blood pressure, blood glucose, and cholesterol for stroke patients post-hospital discharge. And to do this, we partnered collaboratively with VCU Health, Virginia Department of Health, and Chesterfield Fire and EMS.
So this project was a cross-agency collaboration. And
Yes.
Of course, we don't have everyone who had a hand in the project with us today, but can you give us a sense of the partners on the project and the role that each organization played?
Certainly. What I felt like was fun with this project was that we had people from different disciplines. We had a research nurse, we had myself, operational medical director of the EMS and also emergency medicine physician, and we had a former paramedic and care coordinator nurse. And so this team came together because of relationships, because we shared a passion for stroke patients and preventing secondary stroke. Not because we worked together. In fact, all of us had different supervisors and we were in different units in the hospital. It was truly just relationships and coming together for a single purpose.
That's excellent. And I would say there was some innovative leadership there as well, because you all were proactive. You took the initiative to make this happen across organizational boundaries. And that can be challenging work. And that's one of the things we really appreciated as the observers of your project when we're all together in sync. So let's talk about the journey a little bit. To give us a sense of it, what were the key action steps for the project? And what are the results to date? And in asking this, we're also aware that the project launched in 2019, but as with everything else, the pandemic became a factor in 2020.
The first thing we had to do was narrow down our project, which took more time than I thought that it would, because we are coming from different aspects of healthcare, and coming together to narrow down was a little time consuming. We first had to identify who our high-risk population was by using an internal database. We needed to determine what interventions we were going to use and how we were going to do that, who we were going to partner with in the community, build that relationship. Then we need to decide what health indicators to measure and evaluate, because we needed to have some way of determining whether or not we were making a difference. And then we needed to develop program inclusion criteria and enrollment process.
Each step of the way, you're doing this as a team and you're working across organizations and across disciplines. So one of our key themes in the SYNC program is teamwork, especially in the context of interprofessional collaborative practice. So in your project, when you think about people coming together, what were the keys for bringing them together? And can you share a couple of breakthroughs or success stories that illustrate how the team developed?
Some of the lessons we learned was it's challenging coordinating a multi-team member meetings. We all had our separate jobs, and finding a date, time to come together, and we needed to do it on campus. So it turned out that we frequently would have to meet from 5 p.m. to 7 p.m. because it was the only time we all had mutually available. We also realized that a simple idea wasn't quite as simple to implement as thought. There are lots of little pieces that you had to map out. I would say that was great to be forced to sit down and to map it out, versus it was more likely to succeed by doing that forethought before implementing. And what was also interesting is, as a group, we did the DISC personality, and most of the groups in the SYNC project had a diversity of personalities. Ours seemed to be the only one that all of us were the same, and kind of a dominant personality. So a number of leaders, natural leaders. But what was interesting is we did kind of innately focus on one person becoming that leader and leading the rest. And then patience, understanding that we did have some different personalities, and working through those and having to rely on some of those other DISC personality characteristics to propel us forward.
Yeah. And, we can remember, Stacie, when you all presented to the group, sharing those insights. And those insights are so important, because one of the things we learn over and over again with SYNC, with projects that are successful and from projects that struggle, is that it's all about a team culture as well as the structure. And if you're not building that culture while you're trying to address the structure, teams struggle. And so, your team was able to kind of put those two things together. We got to make some structural changes, but if we're going to do that, we have to work together in a culture as a team. And, we had kind of the privilege of watching the team go through that. And I remember that you actually taught the group a lot about how to do this well as a team. So we really appreciate that.
Thank you.
Looking beyond teamwork, another one of our key themes in SYNC is to develop capstone projects that really deliver value. to organizations and community. So how would you describe the value of your project for your organization, VCU Health, but also for the community?
For VCU Health, I would say it was multifactorial. One, in that from the time I graduated from the SYNC program, I have since been promoted to a manager role. And the skills that I learned from SYNC, I'm using every single day. And so I'm extremely grateful for that, because those are things that you don't read in a textbook that I didn't get in nursing school. So, and I'm still dealing with all types of personalities and having to pull a team together. It's also helping in that it's encouraged me to continue, that even though I'm middle management, and that's a hard place to be, is that I still have a voice. And so kind of as an indirect leadership, so to speak. So working from the middle and trying to make that influence and not giving up. And that's a little bit of where that patience comes in, that it's not quick, but you just keep chiseling at it. And even though the project isn't 100% where we thought it was going to be, it's still going. We're still applying the same techniques as on the other side of this pandemic, as we're looking at post-discharge. And we were actually a little ahead of the curve, because now the organization has taken on these CMS stroke bundle payments. And lo and behold, what they need are programs that are taking care of patients post-discharge in their home, which is exactly what AIR Project mapped out to begin with. So kind of had to wait a few years for it to come to fruition, but it is. So that's rewarding.
That's really striking. It turned out to be strategically serendipitous. One of our themes in the SYNC curriculum is 21st century healthcare. And of course, within that theme, we talk a lot about payment reform and alternative payment models. So you're building this program while alternative payment models are developing. And lo and behold, that SYNC experience actually puts you ahead of the curve to be ready for bundled payment, which is really good to hear. Another thing I want to spotlight from your sharing is this idea of leading from the middle. So much of the really powerful work that gets done in organizations is done by teams and leaders who are in the middle of the organization, who have to lead up, down, and across the organization. And you're always influencing. And you talk about patience and keep chiseling away and communication. And that's very powerful, because those management skills, they're definitely part of what we teach in SYNC. But one of the things we learn all the time from our SYNC participants, who really then become our SYNC faculty, right, by sharing their wisdom back, is that idea of constantly communicating up, down, and across the organization is really key for making these projects happen. So thanks for putting your finger on that as well. So Stacie, to this point, we've talked about the big picture of the project, how the partners came together, what you were trying to accomplish. We've talked about the key action steps. We've talked about teamwork, especially interprofessional collaborative practice. And then we've talked about value to the organization. And one of the things we want to make sure of is that SYNC has value for each individual who participates. You know, it's a team-based program, but it's an all teach, all learn type of culture. So I'd like to ask you now to focus on your own personal learning. Could you share a couple of personal insights or ideas that you've carried forward from your SYNC experience?
Certainly. I learned so much from SYNC that it's actually very hard for me to think of one example. But one that does stand out to me allowed me to appreciate the value that the different roles that people bring to the team. An example is we did an exercise where we cycled through the different roles and we had to pretend or take on each aspect. We had the initiator, the dreamer, the pragmatic person, the naysayer, the closer. And that was fascinating, because we knew as you went through that one or two of those felt more natural to me than another. And I would say the most challenging sometimes can be the naysayer. When you're the dreamer and you have this idea and somebody's going, no, 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 and they're always putting obstacles. It was really great because now I pause and go, okay, this person, there's a reason, and it's very strategic and can actually use that to build the momentum, to rely on that person to think of those things that I wouldn't normally think of, and not take it personal, but to actually appreciate their role on the team.
I think that is a profound leadership insight. Thank you for sharing that. That's really excellent. I wish we had more time. Thank you, Stacie Stevens, for sharing your insight and experience with us today. We know that you're actually representing a whole team of committed professionals who worked on this. So we thank VCU Health, we thank Chesterfield Fire and EMS, and we thank the Virginia Department of Health for supporting this vital work. It strikes me that Virginia wins when we have teams like yours innovating for community health. And we appreciate you. We appreciate everybody involved. Thanks very much.
Thank you, my pleasure.
We hope you have gained some new insights and ideas from the story shared. To learn more about the next SYNC offering, please visit syncvirginia.org. That's syncva.org. There you will find more information, can view past projects, and contact us with any questions. Through the generous support of funding from the Virginia Department of Health's CDC, Living Well, and Innovate grants, there are opportunities for teams to attend tuition-free. See the site for details or contact us directly. Until the next time, this is Dr. Tom Ryan signing off. Thank you for listening.